Thank you, Lisa. Thank you so much. You've been such a great supporter of AHRQ, and I want you to know that we are extremely grateful for your support, as well as we want to appreciate your organizing this event. And I will say that this is an extremely important event because it celebrates a very important milestone, 20th year of finding of AHRQ or establishment of AHRQ. So that's really awesome. Well, milestones like this one, anniversaries like this one, give us an opportunity to think about the past, the present, and the future. And it's important that we take a moment to thank the people who have made this success happen for us. So let me start by expressing my gratitude, first and foremost, for our ongoing partnerships with stakeholders, the excellence and willingness and diligence of the investigator community, and for superb staff at AHRQ. I also want to recognize the inspired leadership of AHRQ, which was provided by great and exemplary directors like John Eisenberg, Karen Clancy, Rick Cronick, and Andy Beinman. Thanks also to our great collaboration with our partners. Today, as a result of that, AHRQ has become the premier funder of health systems research, which has led to substantial improvements in the delivery of care in America. We have made a positive impact on the safety, quality, equity, accessibility, and affordability of healthcare. Historic milestones, like the ones we are celebrating today, also provide an opportunity to think about the future and a path forward. As you all know, the world of healthcare has changed dramatically over the last 20 years, and the speed of change is accelerating rapidly. Having said that, if you take a moment and reflect, the nation's healthcare landscape is being redefined by major disruptive forces at play. So just to talk a little bit about them, mergers and acquisitions, infusion of new technologies, Internet of Things, digitization of everything, shifting demographics, and how can one forget the volume and variety and velocity of data flowing into the system. The challenges before us are huge, but opportunities are even greater. I believe AHRQ is uniquely positioned to improve the lives of patients in our ever-changing digital healthcare ecosystem. Through conversations with frontline clinicians, health systems leaders, policymakers, and researchers, AHRQ has identified 3 critical challenges that are front and center in today's healthcare environment. They are, 1, improving care for patients with multiple chronic conditions. 2, reducing the error rate of diagnosis. And 3, ensuring the availability of data and analytics to capture a 360-degree view of the nation's healthcare system. Now, addressing these challenges will require AHRQ to build and leverage our core competencies in 3 areas: systems research, practice improvement, and analytics. And for all these 3 challenges, the solution begins with cutting-edge health systems research to discover new knowledge and provide needed evidence to optimize the quality, safety, and value of care that patients receive. You see, cure and care are 2 sides of the same coin. A few years ago, Congress passed the 21st Century Cures Act to bring us the cures of the 21st century. My belief is that the next frontier is to bring to the American people 21st century care. That is our future. Thank you, ladies and gentlemen. Thank you, Lisa, for inviting me. I appreciate it, and have a great day.
Thank you so much, Director Khanna, for joining us today, and as you said, for the partnerships that you have established here and throughout the country. So the format for this afternoon is I'm going to make some brief remarks and introduce our speakers, And then they each will speak for about 10 minutes, and then we'll have a little bit of time left for Q&A. As we mentioned, we are on Facebook Live, which is certainly my first time on Facebook Live, so that's fun. To begin, I want to do my first round of thanks for our supporting partners in the Friends of AHRQ and who are bringing this briefing to you. And you can see them listed here. And it's really through this coalition, the Friends of AHRQ, that we are able to raise our voices in unison to support the important work that this agency does. Now, as has been already mentioned, we are going to cover the past, the present, and the future of the agency. We know that AHRQ has improved our understanding and responses to issues that have been pervasive and challenging our healthcare delivery system. For AHRQ to continue to do this and be successful in the future, it needs stable, predictable funding to ensure it can deliver on that mission. And as we look to the future, AHRQ is critical to the nation's ability to respond to the future challenges. Just as Director Khanna mentioned, whether that's multiple chronic conditions with the aging of our population or the potential in data analytics, these are critical directions, as well as the enduring focus of the agency on patient safety, now through an added focus on diagnostic error, which you'll hear more about from one of our speakers. So I hope you all know that AHRQ drives these improvements in patient safety, in primary care, in data analytics, and other areas by focusing on improving care's accessibility through data, through improvement, through research. It also makes its work and its support of tools and opportunities to disseminate and implement good research makes healthcare safer. It also helps care become more effective. We don't want to know just what works, but what works for whom, under which circumstances. We know so well of the pervasive and enduring disparities in care, whether that is due to geography, to race, ethnicity, language, or socioeconomic status. And finally, and importantly, making care more efficient. When we talk about value, we need to understand not just the benefit, but also the costs. And AHRQ has been a key resource in helping us understand and evaluate the efficiency of the care system. So our core message to you as the voice of the Friends of AHRQ is that right now it's about funding, right? Any conversation on Capitol Hill, we cannot achieve our mission, we cannot achieve our goals of better care at better value if we do not have the resources. And currently the budget for the agency stands at $338 million for fiscal 2019. But if you look at the long term, the agency's purchasing power has decreased by over $150 million since 2010, so in less than a decade. And also additional capacity that was built up during the stimulus funding for comparative effectiveness research was also lost when that expired. But we know that lawmakers here in Washington see the value of the agency's work. They have rejected repeatedly the administration's proposed cuts and consolidation into the National Institutes of Health. They have enacted 2 consecutive years of increases in the budget, and this year are proposing the largest increase of $20 million in more than a decade as part of the House Labor HHS bill. So the other thing that I want to really flag for everyone is the fact that the agency could lose about 1/5 of its budget on September 30th because it is now coming from the Patient-Centered Outcomes Research Trust Fund. And if that is not reauthorized, it will have a direct and immediate hit on the agency as well of about just under $100 million annually. So we think that, I hope you know that AHRQ is essential to meeting future needs, to address the rapidly evolving data sources and methods. I have to say as an aside, my staff have heard me say this, but if you are, well, most of you are too young to remember this group called the Police and Sting. But there was this great song called Every Move You Make, Every Breath You Take. I changed the rest to say, is a data point. And all of that data needs to be understood for its uses to improve health and outcomes and healthcare delivery. We also have changing business and payment models. We need to understand, again, which ones are working and for whom. We are continuing to look at the rising costs of healthcare, and we have to continue to battle this gap between what we know and what we do, not just in one place, but sustainably, scalably throughout the country, so the right care is delivered to every patient at the right time, in the right way, and in the right setting. And then finally, we want to push for continued improvement in patient engagement in the research. So today we have 4 amazing speakers who are going to speak from different perspectives. I hope you all picked up a packet when you came in. Their more in-depth bios are listed there, so I'm just going to give you their titles. I'll go in the order that they will be presenting. Dr. Bundorf is an associate professor of health research and policy at the Stanford University School of Medicine, a Stanford Health Policy Fellow, and a senior fellow at the Stanford Institute for Economics and Policy Research and the Hoover Institution. So she's not busy at all. Dr. Hardeep Singh is professor of medicine at the Center for Innovations in Quality, Effectiveness, and Safety at the Michael E. DeBakey Veterans Affairs Medical Center and Baylor College of Medicine in Houston. And I would actually say that all of our panelists today are incredibly busy. John Wilbanks is the Chief Commons Officer at Sage BioNetworks and previously a legislative aide to Congressman Pete Stark. And certainly not least, but last to speak, will be Dr. Atul Grover, who is the Executive Vice President for the Association of American Medical Colleges and provides strategic leadership in many areas, but I like to claim him as a member of the Academy Health Board of Directors. So now, over to you, Kate.